Good afternoon. Thank you very much for joining Fulcrum Care and Support and myself, Kima Sutherland-D, for this webinar. We recognise how busy you are at the moment, so we appreciate your time and we hope you'll find it helpful. The webinar is around the emergency support framework, which CQC launched on the 4th of May, and we'll just look at the agenda. So we're going to cover CQC's approach to assessing risk during the COVID-19 pandemic, to help yourselves as providers and managers to understand how and when CQC may contact you for emergency support framework call and the areas that are likely to be discussed. We'll give some hints on how to manage the call and how to assure CQC and how you ensure the accuracy of the information that's gathered, held and assessed by CQC. So first of all, we're going to look at the introduction of the emergency support framework, what it is and what it means. So CQC, as you're probably aware, ceased all routine inspections, regardless of the rating at the time, due to the pandemic and in response to the lockdown. Since then, they've really been looking at and working on methods for gathering information to enable them to make judgments and assess the risk in services and to ensure people are safe and their human rights are protected. Initially, inspectors were asked to review all of their services or their portfolio and make some initial risk judgments based on factors such as the rating, any ongoing enforcement actions, notifications that have been received, safeguarding alerts, and their own local knowledge of providers and locations and histories. Inspectors have been making calls to providers for a number of weeks to initially offer support and advice and point managers and providers in the direction of other resources and agencies. So let's look at the actual emergency support framework and what it includes and covers. So it says here the 1st of May, it was announced on the 1st of May and launched on the 4th of May. They introduced the emergency support framework. CQC states this is not an inspection and will not change your rating. It's a tool to help structure the provider conversations and to give a complete picture of how COVID-19 is affecting services. So since we pulled this webinar together, they've also put out a joint statement with the ADASs, and that's available on the CQC website. If you go to guidance for providers and look at news, you'll see that statement about the emergency support framework, how they're sharing information with other agencies such as local authorities, and how they're intending to use the information. The purpose is, as stated by CQC, is to collectively monitor risk. That means the information gathered will be used by CQC, but also shared with other agencies. That could be local authorities, CCGs, safeguarding, or other agencies such as GPs, and also they're now using it to pull together some insight reports about the state of social care during the pandemic as well. That's not individual results, but it's looking at themes and trends. The results of the ESF scoring will then guide CQC. If they have enough concern and risk to follow up, they could follow up with an inspection, or they could escalate information to other partners. Now, enough concern and risk is a subjective matter, but it's likely to include real concerns about people's health, safety and well-being, safeguarding concerns, any unlawful restrictions, etc. They could initiate an inspection based on concerning information provided by a manager during the call. So they state another purpose is to ensure providers are able to keep people safe and protect their rights, to drive action at a national, regional, local level. So they'll be using some of the results alongside the capacity trackers that are run within the local authorities to look at themes and trends and where perhaps additional support is needed. To identify when providers may need additional support, as I've said, and for providers to ask questions or talk through tough decisions or seek guidance. So how and when might you be contacted? CQC may decide not to use the framework with every provider or location. As I say, the local inspectors are making risk assessments based on all their locations and their knowledge. They will use what they already know and assess how the previous phone calls went to assess the level of risk overall. CQC are very likely to start with providers rated inadequate, or perhaps where enforcement action was in progress but is suspended. This could be maybe warning notice compliance dates have passed but they can't get back to inspect, conditions upon registration, notice of proposals or decisions pending appeals. They may prioritise those services. CQC is then likely to move on to those repeatedly rated requires improvement before they consider other services. Where a provider or location is rated good or outstanding, they might not even receive a call, or they'll be the last on the list to be contacted later on down the line. CQC will contact you by phone or email to arrange a convenient time for the ESF call. They usually use Microsoft Teams, which is just a platform, and they'll provide you with the login details and the mobile dial-in details so you can join the call. It's predicted and planned that the call will last approximately 1 hour. That very much depends on how much you want to tell them or any subsequent questions the inspector's asking of you. So what's covered in the ESF? It covers 4 main areas: safe care and treatment, staffing arrangements, protecting from abuse, and assurance processes, monitoring and risk management. These generally align to the usual key areas of an inspection of safe and well led, and they cover regulations 11, 12, 13 and 17 broadly. There'll be a score generated. When the inspector has the ESF call with yourselves, they'll mark yes, no answers, and they produce a score as well. And this will then be used to determine if the inspector thinks there's risk at the service for people, and if an inspection is triggered or information shared with others. Following the call, a summary report will be sent to the provider. This just gives yes/no assessments to the standard statements and questions asked. There's an overall summary at the end, which will be very brief unless there are issues picked up. One example we've seen just states, the organisation and manager have been proactive in the protection and care of people and staff. So it's not a full inspection report. It won't be published in any way, and it won't be shared as a whole with local authorities. What will be shared is any risks or concerns that come out of it. However, if you choose to share it as a positive with your local authority and your commissioners, then you're free to do so. So let's look at safe care and treatment first, the type of things that are going to be included. So assessment and risk and how those are adapted and managed in relation to COVID-19. So thinking about how you've adapted the risk management process, how you've assessed the risks related to COVID-19 and then managed those. Have you assessed risks related to COVID-19 and managed those risks, as I've said? You'll need to show that you already had infection control policies in place and how you adapted them to cope with preventing and controlling COVID-19. So how you expanded your existing infection control policies. Did you have enough PPE to manage the impact of COVID-19? That can include the right cleaning products and staff PPE and PPE for safe visitors or contractors entering the home. We all know the struggles most services have had in gaining supplies, particularly earlier on. And you can describe the difficulties you've had and the challenges you've faced. If you're still having problems, definitely you can say that, but also try to think about any solutions you've worked on to get a more regular supply. So again, PPE stocks, supply and how you've managed that supply. You might want to consider if you contacted the local authority, for example, or the National Supply Disruption Line. Then think about your environment and if you've adapted it to prevent the spread of COVID-19. So that could be cohorting certain people in different areas of the home than they normally be in, so moving rooms around, the way you move people around the service, and measures you've really taken to prevent the spread. And that can include perhaps thinking about any specialist COVID cleaning you've put in place, so wiping touch surfaces, etc. How you've made it clear to staff, people and visitors about the risks and prevention. So think here about signage to explain lockdown and alternative methods for family to make contact, hand washing and PPE usage for staff, visitors and contractors, and how you may have helped people understand the risks. So hand washing signs for people, explanations or other measures you may have taken. Then it moves on to medicines, how you've managed medicines before and any changes to adapt for COVID. Perhaps did you have any difficulties re-medication because of COVID and what did you do? So think here about your supply, your stock, using latest guidance on end-of-life medication and their reuse in certain circumstances. And we've included a couple of links there that if you haven't already got, we would advise that you print those off or have them available for yourselves and staff. How have you managed risks to people, both the usual risks such as falls and those related to COVID? So think here about, again, your normal risk assessment and management processes for any risk, falls, malnutrition, pressure area care, etc. And then what have you done about the risks related to COVID? So if you notice somebody with symptoms, how did you assess and manage that risk to try and prevent the spread? Then we move on to the section on staffing arrangements, and you'll be asked about whether you've had enough staff to provide safe and respectful care. If you haven't, what you might have done. Has staffing been affected and what have you done to mitigate that? So again, think about any arrangements for getting additional staff into the home, staff working additional hours, letting the local authority know whether they've been able to provide any resources. Think about, do you have a plan for managing really low staffing levels? So if you don't have one of those, we would advise you write one up to have available that you can explain to the inspectors during the call, and so that you can manage really low staffing levels. So think about if it gets to critical levels, who you need to inform at the earliest opportunity and what your plan is. How have you planned for and managed staff health and well-being? Has COVID affected this? So think about staff who may have been shielding due to medical conditions, what you might have done to keep in touch with them to make sure they're okay. Your existing staff working on the floor, is there anything you've done? Arranging testing for them. Maybe ways you've looked after their well-being, good things you've done around that, and any struggles you've had with that as well. Then we move on to protecting people from abuse. CQC and other agencies have been particularly concerned about homes, residential homes and services becoming very isolated during the lockdown. So they're not getting the usual number of visitors, eyes in the service, who may have been able to spot potential problems and restrictions and abuse before. And therefore they're really keen to know what services are doing to protect people. So how have you protected people from abuse, neglect and discrimination? Have you managed any safeguarding incidents during the COVID restrictions? And what did you do to respond and report? And did you follow your normal procedures? So particularly with neglect and discrimination, you will need to consider for the call mentioning things like DOLS applications, restrictions, how you've made sure that people's consent has been assessed, etc. And the last area that CQC will ask you about is around good governance, really, assurance processes, monitoring and risk management. Have you continued to assess the quality of the service and any improvements? How have you done this? So here you need to think about, you would normally go through a quality auditing process. How have you maintained that during the COVID pandemic? Have you noted anything that required improvement and what actions have you taken? How have you and the provider stayed up to date with the latest guidance? So think about gov.uk, CQC website, Public Health England, NHS guidance, or anything your particular local authority may have done. You might also think about Skills for Care, who've pulled together COVID resources as well. Have you identified areas for improvement, and what did you do to improve? So consider here, again, your normal quality processes, but also take into account COVID and anything you've done to improve people's lives or the safety during the pandemic. Also consider what the provider has done to stay in touch with you and support you as managers, and how have they made sure that even if they couldn't visit, that the contact's been maintained to assess quality. Have you made it clear to staff and supported them to report concerns during COVID-19, and how have you done that? So you may well normally have staff whistleblowing lines, you may normally have ways that staff report concerns through you, but have you done anything different? Again, it's that concern about closed environments where staff may feel less able to speak up. CQC have noted a reduction in staff whistleblowing and people generally reporting concerns to them, and they're worried about why that might be. So again, what have you done to encourage staff to speak up and be open and transparent and report things? Have you and the staff managed to maintain records, and has COVID-19 affected this? So normally your standard of record keeping may be very good, but you may have had staff shortages, staff been working extremely through difficult times, extremely hard and stressed if you've had COVID-19 in the home. How have you managed to maintain the essential records during this time? And how has the provider and the manager worked with others? So consider other agencies that you've spoken with, that you've sought support and guidance from, that you may have shared good practice with. Consider how you've been outward looking during the pandemic. So that's the end of the 4 sections that you'll be asked to cover. And now we'd like to share some tips on managing that call. First one, and fairly obviously, but worth stating, is be prepared. Have the evidence covering those questions and the notes you need on hand in a file, and start gathering them as soon as possible. Don't wait to hear from CQC. Have them to hand where you can get them ready for the call. Once you've gathered your evidence and notes, you should feel more confident about the call. It's not supposed to be a formal inspection, but the results could have an impact for you in the service. So ask the inspector to record the call on Teams, so that if needed, you could ask for that under freedom of information. Make a note of that request and the answer given. Try and stay calm, ask for questions to be repeated, and ask what evidence would enable the inspector to answer the question if you're unsure. Be as clear and concise as you can be with your answers. You can and should share some examples to demonstrate what you do, but try and keep them short and to the point. This will help the inspector gather the answers in a clear way, and there'll be much less room for any miscommunication or misunderstanding. Keep your own notes throughout the call. You don't need to make a note of every question they ask you, because many of them are standard questions. But if they're asking you subsequent questions or follow-up questions, you may keep a note. And keep a note generally, as best you can during the call, of the answers you gave, how the call was going, etc. At the end of each question, ask if the inspector has what they need and if you could add anything to assure them further. Ask if you don't have the right evidence to hand, if you can supply it within a very short time after the call. You may not be expected to have everything you need to hand at the time, but you should certainly be able to talk through what you do and what evidence you have available in answer to each question. At the end of the call, ask what the score or the result is and when you'll receive the summary report, and make a note of that. Ask what the results of the call means for your service and what may follow, and again make a note. Ask for a copy of the assessment and any information that was used. Now, CQC may well not choose to share that with you because they're saying this is an internal methodology, it's not a rating inspection, etc. But if there are any difficulties, you could request it under freedom of information at a later date. Again, make a note of any requests. Ask what right of appeal or representations are available to you. If you're not satisfied with how the ESF call was conducted, or once you get a summary report, then please do straight away email the inspector and copy in CQC National Contact Centre using the email we've included. Most of these calls, I'm sure, will go smoothly and well, and you'll be able to put across to a supportive inspector what you do in your service to keep people and staff safe and how you've been managing during this difficult time. However, if you do feel that call did not go well, that you weren't able to put across your thoughts and your evidence, then please do be in touch with them as soon as you can. Fulcrum Care has some further support available to help you to plan and gather the right evidence. This can include one of our power hours where you'll have some one-to-one time with a consultant to plan and review your evidence and to answer your questions about the ESF so that you're more prepared or feel prepared. And then you can find some CQC information under, again, news and stories, and there's information there about the ESF. So during the webinar, we had a question and answer session. Some of the questions were around specific evidence, and then somebody who'd already been through the call explained to us how that had gone from their perspective. They talked about the fact that the inspector didn't offer any advice or support, that it was useful to think about when they did have difficulties such as the supply of PPE, that they put across to the inspector what they'd done to manage that situation and to take action, rather than just leaving the inspector with the impression that there was a problem in the service. So that was useful to think about. I hope it's been a useful webinar for you. Again, if you need any further support, please go to the Fulcrum website and be in touch with us and we'll support you through. Apart from that, when you do get your ESF call, I hope it goes well for you and that it's a positive experience. So thank you for listening.